The sexual reproductive health rights of an individual are a priority. Triumph Mental Health Support in coalition with My Story Initiative and Uganda Mental Health Fellowship at Kontola take on this movement to reach out to girls and women with psychosocial disabilities to raise awareness and encourage them to speak up for themselves.
I, as Goretti, I understand sexual reproductive health rights as the rights all human beings are supposed to be having. Because sometimes we person with disabilities, we don't normally use or follow those rights. Our parents, the partners, they tell us, no, like you're having a disability, you're not going to get married.
According to me, sexual reproductive health rights are the rights that a person has in the area of reproduction. It could be, let's say they have a right to give birth, especially if I'm also now focusing on women and girls with psychosocial disabilities.
These are the rights that a person with psychosocial disabilities especially has to manage their sexual life.
The rights to express yourself about giving birth, relationship.
These are rights of an individual to make well-informed decisions concerning his or her sexual reproductive health, and doing this without coercion, being forced, or without violence.
Mental Health Fellowship at Kontola has done a lot of interventions on making girls and young women with psychosocial disabilities access sexual reproductive health through training them. Train them about understanding their rights, because most of them are ignorant about that. As we build their capacity to understand their rights, it also boosts their confidence to know where to go to know where to run to in case their rights are violated, in case they don't have access to information as regards to sexual reproductive health. Yeah, and as we're speaking right now, we have different stories that weren't there before. They now come and tell us what they go through. Those that are harassed come to us and seek for, guidance on maybe where to go to report to, and maybe to acquire could be sexual reproductive health services at the health center, just like we are located at the health center. So nowadays it's simple for them to come and access these services.
We carry out what we call sensitization and awareness raising. We have held a number of workshops trying to tell them about their sexual reproductive rights and even other rights according to the CRPD, the Convention of Rights of Persons with Disabilities. So that is how we have ensured that they are aware of their rights, and also we have trained them to be self-advocates, to advocate, to demand for their rights.
Those trainings have developed me on the skills of fighting sexual reproductive rights, and I've been able to do that because, as I said on a previous work, I refused totally, and I looked for help, because of sexual abuse from my boss. Even me, I've fought for other people, like educating some parents about early child marriages.
I have been able to easily access information on my sexual reproductive health through people that I have identified as mentors and who have helped me in the journey to know more about myself, to know how to, how to stand for my rights.
We usually have meetings, and we also go for peer support group meetings in some villages like in Buwenda, Butagaya, Iziru. So there we are able to meet some people, and we are encouraged.
Through trusted sources like in Triumph Mental Health Support and Recovery Program, we do have the mentors, executive director, who have been very key in supporting, and whenever I go to the hospital, since I was able to build my self-esteem, I always ask the doctor what I need and not let them tell me what they think I need, and yet they have not listened to my side of the story.
What motivated us is that our young girls and young women have always been taken advantage of. Because of the psychosocial disability, they feel maybe sex is by just chance and not choice. Yet they have equal rights like any other women. And in this respect, since they suffer a double challenge, being a woman and at the same time with the psychosocial disability, and we have seen a number of them having fatherless children.
I am a woman that has experienced a lot of rights violations. I really felt it is very important to raise a team of advocates, because through it all, I have emerged as an inclusive disability advocate for rights of persons with disabilities and mainly persons with psychosocial disabilities, because they are the most marginalized and always underrepresented.
Whenever you meet girls with psychosocial disabilities, just like it is with mental health, it's normally given less priority. That's from planning to implementation level. So you find that even at household level, girls and young women with psychosocial disabilities are always left out. That's in terms of accessibility to services. It could be to the information as well. So you find they are leaving behind as well. But then you find they also have a right to health or to enjoy or to fully participate in the society like other people. But then you find there is a gap. So UMHF comes in to fill that gap.
By educating them about sexual reproduction and also their rights and every other thing, so that when they go into sex, it is by choice and not by chance. And they have to know all precautions, because we have HIV/AIDS prevailing. They have to know how to use, to demand for maybe use of a condom, any protective measures, testing before going into sex, and also knowing that they have a right to even found a family according to the CRP.
You find like the girls that I can't mention now here, one was raped, that's during an overnight somewhere here in Jinja. And when the parents, when she wanted to seek for justice, the parents, of course, they want to go in because one, they knew the police wouldn't hear their story, hear their side. They don't have the money. They couldn't outcompete with the other, the culprit. And then there are those ones. There is one again still in Jinja that was forcefully asked to abort because the mother thought her being a person living with psychosocial disability can't give birth. But first we believe she has a right to a family, to have kids. So with such stories, you find it inspired us to come out and be a voice for those voiceless out there.
So with the support of Disability Rights Fund and the Disability Rights Advocates Fund, we've been able to work among the younger people. We've raised a team so far of 24 younger people whose capacity has been built. So we have hope for sustained advocacy. Developed a mentorship program with the support of Creative Action Institute, because they major on developing girls in leadership and in advocacy. As we pursue leaving no one behind, we should continue still to deliberately reach out to those again who are most left behind.
So in terms of girls and young women with psychosocial disabilities, they are actually ostracized as based on their disability, but also in terms of the right to access some of their services. And of course, this has partly impacted on their quest for these services based on the attitudinal barriers. In terms of access to information, oftentimes persons with psychosocial disabilities require to access information in easy-to-read formats or accessible formats that is easily interpretable for them. But in most cases, this information is always provided not in accessible formats. And that creates a challenge for most of the young women and girls with disabilities, psychosocial disabilities, to get to know of this information and how it could be utilized. Of course, the component of legal capacity vis-a-vis mental capacity is still a big challenge. Most persons within the communities believe that persons with psychosocial disabilities generally, and specifically girls and young women with psychosocial disabilities, do not have the right to legal capacity vis-a-vis mental capacity, which is of course wrong, but it is something that requires the community to change in terms of mindset and the perception they have around the issue of access to services around sexual and reproductive health by women and girls with psychosocial disabilities.
Especially on the marriage side, relationship, sometimes the parents decide for their daughter that you will not manage to marry, to give birth, and they move in making decision for her. Yet even a person with a psychosocial disability can make right choices and stay in marriage progressively, because I see myself, I'm about to also make decisions for marriage.
But when he realized it, he got annoyed. How can I introduce you to my friends? You who is having a psychosocial disability, you're a mad person. Can you even give birth? Even parental care. Others give birth to babies, then the babies are removed away from them. You can't take care of her. You can't, because you're having psychosocial disability. So it inspired me to fight for our rights, because we're also human beings.
So in my community, I've been getting some girls to teach them how to fight for their rights, and counseling some people who get sexual abuse, sexual reproductive health challenges like sexual abuse, some abused by even their friends, relatives. So I always teach them the confidence to speak about their rights.
Advocacy empowerment came out strongly, because there is no way you could and you can advocate for sexual and reproductive health rights of girls and young women with psychosocial disabilities without bringing girls and young women with psychosocial disabilities to participate. But the only way we could actually do this was to come up with self-advocacy empowerment. And the organizations have identified the youth on how best they can be empowered to speak about their issues in schools, but also in debates within the MDD strategy, music, dance, and drama, which Triumph Mental Health Support and Recovery Program is actually doing. But also very key was the issue of economic empowerment. Because if you do not empower women and young girls with psychosocial disabilities, then in terms of their quest for the sexual and reproductive health rights will be, hampered. And so here we are actually looking at how best these organizations can support young women and girls with psychosocial disabilities to benefit from government programs like Youth Livelihood Program, Uganda Women Entrepreneurship Program, WEP, and other programs like Emyoga, to see that they raise some money to manage their living. Of course, with economic empowerment, then the issue of independent living will be realized in line with the UNCRPD Article 19. Also very key was the issue of building and strengthening the capacities of the different key players. Here we are looking at, for example, health workers, how they could be empowered, their capacities built around understanding psychosocial disability, but also the unique challenges and the enablers that the girls and young women with psychosocial disabilities require in their quest for sexual and reproductive health. We also actually had to empower, to build the capacities of traditional leaders or our clan leaders, because it was also at the center as decision makers in terms of marriage and all those incidental. We actually felt it was necessary to build their capacities. But also at the center was to enhance peer-to-peer learning through the peer support groups that came out very strongly. And so they actually believed in order to support this, the organizations under the coalition felt it necessary to come up with, for example, the meaningful youth engagement strategy on how they could build the peer support groups and the peer-to-peer learning around the sexual and reproductive health. Also very key, we actually wanted to change the mindset of the community through some of the strategies, for example, the social behavior change communication strategy, which the organizations, I believe, are actually now taking on, because there was need for us to come on how best to create the social change within the sexual and reproductive health context.
I could encourage young women or young girls to always speak out for themselves, because no one else understands them more than they do.
In case you're having issues in the area of sexual reproductive health, look for a trusted source that you can reach out to and share with them, so that you can see how you can get a solution to what you're going through.